First, I start by verifying my physician order. I'm going to gather all the supplies that I need for this dressing change. And then I will identify my patient. Can you give me your name and date of birth? And I'll match that name, date of birth with the identification and with the MAR. And then I will perform hand hygiene. And then I'm going to apply gloves. Okay, I'm going to now take out the soil dressing. I'm just going to reveal just the part of the dressing, not too much of the patient. And then I'm going to hold the skin so that it won't hurt the patient while I remove the tape. I'm going to start with the edges first. Okay, and then I'm going to look at my dressing and my incision. There's no exudate, no swelling. The edges are approximating. I'm going to discard my soil dressing in the biohazard bag. I'm going to take off my gloves. I'm going to perform hand hygiene once again. And then I'm going to put on another set of clean gloves. And then I will open all of my packages of gauze and my AED dressing. And then I'm going to verify the expiration date and that it's not expired. And I'm going to pour some out. And then I'm going to pour some on my gauze for me to clean my incision. This is normal saline. And then I'll begin with cleaning my incision. And then I'm going to squeeze some of the excess saline out of the gauze. And then I'm going to start by first cleaning the inner part of the incision. And then I'm going to discard. Then I'm going to repeat that step with squeezing the excess saline out of the gauze. And then I will clean the outer part of the incision farthest away from me. Now I'll discard. And then I'm going to get my last gauze. I'm going to squeeze that excess out. And then I will clean the other outer part of the incision. And then I'm going to discard. And now I'm going to dry this incision with the same formatted cleaning. I'll go with the inside first. And I'm going to discard. And then I'm going to do the outer farthest away from me. I'm drying the outer part. Then I'll discard. And then I will dry the opposite side. Getting all of that excess saline off. And then I will apply gauze on the incision. And then I'm going to apply my AED dressing. And then I am going to take the edges of all four sides onto the patient. And I put less tape on the patient so that when it gets ready to take off, it's not going to tear the skin or hurt the skin being removed. Okay, now I will put my name and date on the dressing and the time, and then I'm going to discard my gloves, perform hand hygiene, and then I'm going to document that there were no excess drainage, no exudate, just mostly the appearance, and I'm going to document the type of dressing that I put on here and how the patient tolerated the dressing change, and that's all.